Well, let's dive in. We expect to have a lively session today. I know we have a lot of people who will continue to join us over the next few minutes. So we will be answering questions today. So we encourage you to use the Q&A function, which is located typically at the bottom of your screen. So for those of you not familiar with NETEC, and we appreciate you being here today, we are an organization that is trying to set the gold standard for special pathogen preparedness and response across health systems in the United States with the goals of driving best practices and closing knowledge gaps like we have for Hantavirus and developing innovative resources that we hope you will find helpful. So we have 13 regional treatment centers, much like the trauma network where we have different levels. We are in the process of developing that system, but right now we have 13 regional treatment centers scattered across the United States. You can see those listed here. So if you have further questions or need specific assistance, please don't hesitate to reach out to either NETEC or your regional treatment center. So NETEC has 4 primary areas of focus. We have consultation and assessment, where we help facilities really think about their own level of preparedness, and we provide on-site and remote guidance. We have training and education for things like today's webinar, but also an entire online repository of tools and resources, some of which will be referenced later. We also have HCEP compliant exercise templates. We also have a research network that supports a central IRB with policies and procedures for data capture for facility research, a specimen biorepository. We're also branching out into the rest of the world with international partnerships, specifically to really strengthen the relationships of those other folks across the world who are dealing with kinds of special pathogens that we are. So today we're going to try to answer as many questions as we can. We're going to give you a brief overview. We're going to start with an Ebola situation report, an overview of the current Andes hantavirus and Ebola outbreaks. We will then talk about laboratory considerations and waste considerations, personal protective equipment, and EMS. And so I'm thrilled to be joined by several of my NETEC colleagues. So today we have Dr. Vikram Mukherjee, who serves as the co-principal investigator for NETEC. He's also the chief of critical care at NYC Health and Hospitals Bellevue and the chief of Bellevue's Special Pathogens Program. We have Vicki Herrera, who's a research coordinator at the University of Nebraska Medical Center in the field of infectious diseases and bioaerosols, and she's a co-lead for NETEC's laboratory working group. And Dr. Alex Isakoff is the founding director of the Office of Critical Event Preparedness and Response, or CPAR, at Emory, and the director of Emory's section of pre-hospital and disaster medicine, where he leads Emory EMS. Dr. Isakoff also serves as co-lead for NETEC's EMS working group. And I am Jill Morgan. I am the site manager for Emory's biocontainment unit and the co-lead of NETEC's PPE working group. So we're grateful to have those speakers here, and we're grateful that y'all are here to learn more about this hantavirus. So with that, I would like to hand it over to Dr. Vikram Mukherjee from New York Health and Hospitals Bellevue.
Well, thank you, Jill, and thank you everybody for joining this town hall and taking time out of your busy lives. I know we were supposed to be focusing almost entirely on the ongoing Andes virus, hantavirus situation stemming from the cruise ship, but given what happened over the last few days, we thought that it would be a nice refresher to just update on an equally, if not more concerning situation on Ebola that's going on in sub-Saharan Africa. So as you may have heard on the news, there is a concerning outbreak of Ebola virus out in the DRC and has spread to Uganda as well. This is the Bundibugyo strain of Ebola, which importantly doesn't have any approved vaccines or any other countermeasures. This was declared as a public health emergency of international concern on May 16th. And the numbers, as you can see, are going up by the hour. And as of this morning, the reports are of more than 500 suspected cases, more than 131 suspected deaths, multiple healthcare workers infected, including, as we know, an American citizen who was doing missionary work in the area of the outbreak. As you can see from the map here, this is where the focus of the outbreak is in the Ituri province, which also has neighboring borders with South Sudan and Uganda. And we now have reliable information that there is spread to a major cosmopolitan area, the capital of Uganda in Kampala. Why this is of relevance to us? By the time this was declared to be an incident, the first reports came out with more than 250 or so suspected cases, more than 60 or so suspected or confirmed deaths. And because it was caught so late in the game, we feel that this outbreak already has spread across multiple jurisdictions and control measures are now being implemented. Now, one of the reasons why it was tough to pick this up quickly is because the standard Ebola lab testing platform doesn't really catch Bundibugyo strains, so it was testing negative. And finally, genomic sequencing confirmed that, of course, this was an ortho-Ebola virus, the Bundibugyo strain. As you can see in these slides, numbers keep inflating, and I think all of us recognize that it's going to get much, much worse before it gets better. Of relevance, there are American citizens who were doing faith-based humanitarian work in the region. As you know, one American citizen now is confirmed positive and is being moved over to a German high-level isolation unit, very well equipped, along with his family. And we're trying to make sure that our healthcare workers, our colleagues who are working there, are getting the help that they need, as well as our federal partners are sending a lot of support there to make sure that this can be controlled as well as it could. Again, I recognize this town hall was focused on hantavirus, but I think it would be a bit tone deaf to not mention this. And I urge all of you to make sure that your frontline hospitals are following CDC and NETEC guidance in case this continues to evolve in a bad way. I want to now switch over to what was the core mission of our talk and get an update on the Andes hantavirus. As of May 17th, over the weekend, we now have across the globe 11 cases, 9 confirmed and 2 probable. Of note, we do not yet have a US confirmed case of Andes virus hantavirus. The most recent case is a new case was identified in the British Columbia, returning from the cruise ship. Of note, again, all the confirmed cases are from passengers on the cruise ship, while there have been exposures on a couple of flights, one from St. Helena to Johannesburg, one from Johannesburg to Amsterdam. None of the passengers exposed to a patient on that flight have tested positive yet, which gives us a bit of reassurance because we're looking at the cruise ship as the hub of exposure, and thankfully there's no other exposure right now. I would like to mention also that there are these news reports about hantavirus being diagnosed in Illinois and upstate New York. Please note that those are sin nombre hantavirus, which does not transmit person to person. The one that we are looking on very carefully from this cruise ship incident is the Andes virus hantavirus, which, as you know, does transmit human to human. Monitoring, we have a few people in the US who have been exposed either on the cruise ship or on a flight next to an infected passenger. A fair fraction of that are being quarantined or isolated at the National Quarantine Unit in Nebraska and will stay there for a little bit. The other few, around 25 other asymptomatic individuals, are in their home jurisdictions being monitored by their jurisdictional and state public health folks. And the reassuring factor now is that I think between the public health partners and CDC and our NETEC Respect colleagues, we have clear line of sight on anyone who had any degree of exposure to either the cruise ship or on a flight from the cruise ship. And we now have escalation pathways where if that individual were to develop symptoms, we have routes of how they would get tested and how they would be isolated in a biocontainment unit. I'm optimistic that this Andes virus hantavirus we have in the US good control of. But I would urge you that, we keep an eye on this, but pay a lot of attention to the ongoing Ebola situation, which honestly is fairly concerning at this time. So on that note, I will pass it on to my esteemed lab colleague, Vicky Herrera, to take us through lab safety. Thank you.
Hi, thank you guys. So we've had a lot of questions on just the laboratory safety and how to handle specimens. So as of right now, the current recommendation is that you can utilize a BSL-2 laboratory with BSL-3 precautions for specimens that may come from an individual that is suspected or has confirmed Andes hantavirus. So what that means is that BSL-3 precautions should be in place, including gown, gloves, eye protection, and an N95 respirator. As always, you should do your risk assessment based on your facility. We know that labs vary greatly in both the instrumentation that they have and vary greatly with the configuration of that. If you have a biosafety cabinet, it is always recommended to use a biosafety cabinet to process any specimens that you can. You want to avoid aerosol generating procedures, such as things that we already know that may cause aerosolization, such as centrifuging, vortexing, avoiding the sharps, and of course, being mindful of spills and splashes, as well as what personnel are in the area and how many people may be dealing with that specimen. There has been reports in the literature that multiple body fluids can harbor the virus. So being mindful of all the different bodily fluids that you may get and treating those all with BSL-3 precautions. As of today, keep in mind this is ever changing, but as of today, IgM and IgG is currently available at the CDC. There is only one facility that is able to do a CLIA approved molecular test, and that is the Nebraska Public Health Laboratory. There are some other laboratories that are in the process of bringing up some molecular assays. However, as of today, they are not validated and ready for use at the moment. But please contact your local public health to determine the appropriate testing as well as the appropriate specimen and specimen requirements and shipping temperatures and all of that good stuff. This has been a question that a lot of people have asked too, is what to do with the waste that may be generated, both from a laboratory perspective as well as a patient management perspective. As of right now, and again, this could change, the Andes virus does not currently have a definitive Category A designation by DOT. They specifically call out hantaviruses with renal syndrome and not the hantaviruses with pulmonary syndrome on their Category A list. But keep in mind that is not an all-inclusive list on the DOT. But in the absence of a Category A determination, it can be classified as a Category B. Again, please keep in mind that this can change and that you should consult with your facilities, your local experts in waste management. There may be other requirements based on your state or local rules and regulations. So what that looks like is that if the waste is infectious, but it is not on the Category A list, it is considered a Category B, which is your regulated medical waste. So there is a flow chart that you can find on the DOT website to lay this out. This also goes along with packaging and shipping. Right now, again, since the DOT does not specifically have it on its list, it is not listed as a Category A. Both CDC and NETEC are waiting for official guidance from DOT. We've had experts that are working with them to specifically classify this particular species of hantavirus. There is a manual from Safety Pack that currently recommends that it can be shipped as a Category B. It specifically calls out the pulmonary syndrome, but that is for the US only. Places in Canada or other parts of the world, it is considered a Category A. So please keep in mind that this designation can change, but we are working and will push out any guidance that we have as soon as it comes out. So in the meantime, facilities should really consult their local public health partners to help them determine the appropriate shipping category and conditions that are required, as there may be other state and local jurisdiction rules and regulations that come into play here. All right, and with that, I will turn it over to Jill.
Thanks, Vicki. So I know we've gotten a lot of questions about PPE, and I think this is a great example of one of the difficulties of working, as we all do here at NETEC, with emerging pathogens, and that's that there's an awful lot about things that we don't know. So I assume that most of the folks who are interested in this are familiar with what we consider sort of this chain of infection and how pathogens move from the organism into or in a reservoir and exit through some portal to get out of a person or an animal, a vector of some kind. And then there's a mode of transmission that lets it get into one of us, and that we have to be a susceptible host to that organism. And so this is probably a well-known chain, and it's what we base our transmission-based precautions on. And yet sometimes there are gaps in what we know. And certainly hantavirus is something that is much more common in other parts of the world. We have various hantaviruses. It's a fairly big family of viruses. Some are old world. Those are affecting Europe and other parts of the world. And then we have new world hantaviruses that affect North America, South Central and South America. But we only have, of all those, we only have a few that have person-to-person spread. And so these have really not been on people's radars here in the United States much for work on how to treat them, how to think about what PPE should be used, or is there an EPA-approved disinfectant? But these pathogens have been existing, as you can tell by the name of Andes hanta, in the Patagonia area in South America. And so for our neighbors to the south, this is a pathogen that is more well known to them. But there's still a lot that we don't know about the specifics of those pathogens because sometimes testing is not very easily available, as you just heard from Vicki, and that sometimes people aren't presenting for treatment until they're quite ill. And so knowing whether someone's infected early or not, or infectious early or not, is difficult. So with this list of unknowns, when we have a new pathogen, how do we apply transmission-based precautions when we have things we don't know? We know that in animals, which are the reservoir for this virus, typically rodents and maybe different kinds of rodents depending on where you are in the world, of course, we know that in rodents, infectious virus can be found in dried urine, dropping, saliva, anywhere these rodents have been. So in their nesting material and in things that they may have eaten, like packaging. And that when humans are disturbing that stuff, so typically spring and summer, when rodents are active and we're more outside and doing things, or maybe we're cleaning out a garage or, someplace that has had a rodent infestation, that we're more likely to disturb those droppings and potentially get this virus into us. Again, with Andes hanta, we've not had any of those cases in the United States. We don't have that particular strain of hanta in the United States, but we do have other hantaviruses. So if we only know what's going on in animals, we're still trying to answer some of the questions for humans. Like which body fluids are infectious. We know we can find it in serum. We can find it in other things, but can they be infectious to other people? We think about things like an infectious dose. And right now we don't know how much of the virus you might have to get in you to make you sick. How close or prolonged must contact be? And right now, we think it's probably, and you hear these terms thrown around a little bit, about maybe 30 minutes and within 3 feet. So we know that it's more commonly spread when people are, for instance, cohabitating, sexual partners, people like that. So you're talking about very close contact. And that certainly was something that was probably replicated a bit on an enclosed space or anywhere else where we might be really breathing each other's air and in each other's space. So when a person becomes infectious, how long that infectious period lasts, these are all things that we're still trying to answer, but they affect how we choose our PPE. So when we think about what do we want to do to be proactive to protect the U.S. healthcare system, and specifically, I'm going to speak to the U.S. healthcare system. There are standards that exist in other countries, and we won't go into that. But thinking about healthcare workers here in the United States, we want to do a good job and be proactive, protecting them in a worst case scenario. So if you're treating a suspected or confirmed Andes hantavirus patient, I want to be clear that there are other hantaviruses out there that might not need this level of protection because they do not have person-to-person spread. But for Andes hanta, that does, we want you to have eye protection with a full face shield or the shield of a PAPR or powered air purifying respirator. We want you to protect your nose and mouth with a NIOSH-approved N95 or elastomeric or powered air purifying respirator or PAPR. We want you to wear a fluid protective gown. So these patients, if they in fact have Andes hanta, can develop, as Vicki and Vikram said, Hantapulmonary syndrome. And that can be a very rapid decline in people's respiratory status and needing critical care interventions. So we want you to protect yourself with a fluid-resistant gown, double gloves, so the outer pair are extended cuff that really does help hold the gown in place, but also protect that really vital glove-gown interface where we know healthcare workers have a potential for exposure. And shoe covers or boot covers are optional, depending on where you are in the country. There are some public health agencies that do think that shoe covers should be mandatory there, and that's, of course, up to your local regulations. But this ensemble, we think, is protective for what we know and what we don't know right now about Andes hanta. So I'm going to turn this over to Alex Isakoff, and then we'll get back to a few more questions and answers after Alex's presentation. Thanks, Alex.
Thanks, Jill. Appreciate it. And for the panel, get ready because my comments are going to be brief. This is aimed at the EMS community and really applicable probably to the entire frontline, healthcare community. How do you prepare for any high consequence infectious disease? And people on this call have probably heard it from us at NETEC before, but we really try to anchor in this paradigm of identify, isolate, and inform. Identify by asking questions about signs and symptoms, recognizing the presentation of somebody's illness, and asking them questions about recent travel to places where infections like Andes hantavirus are geographically isolated. As Jill had mentioned, there's no Andes hantavirus among rodents in the United States. So you have to come from somewhere where that disease is geographically isolated, like the Andes Mountains in Argentina and Chile. So that or close contact with somebody who's ill with the disease. So that's identify. The isolate component is a lot of what Jill was just describing, and it's taking measures. Once you have some concern because of questions that you've asked about travel or close contact with others that are ill, or have a recognition of presenting signs and symptoms, if you think someone actually has a chance of harboring a high consequence infectious disease, then we want to take measures to protect ourselves, protect other responding personnel, protect bystanders by implementing infection prevention measures, an appropriate PPE ensemble, and some other hierarchy of controls, which we'll just touch on in a bit. And then the question is, well, who would you inform? Well, if you're talking to a patient, evaluating a patient, come to conclusion that you think they have a high consequence infectious disease, then you want to inform, obviously, other members of the response team so that they can take appropriate measures in implementing standard and transmission-based precautions that are appropriate. Certainly, if you were transporting the patient, you would want to alert the receiving facility. And in cases where you do have the potential need to transport a patient where you're concerned they have a high consequence infectious disease, it's always good to get guidance from your state health department about whether or not a specialty transport unit might be available. As it relates to Andes hantavirus, the likelihood that anyone in the frontline healthcare community is going to encounter someone with Andes hantavirus in the United States is very low. As Vikram described earlier, travelers that have come in contact with those that had hantavirus on the cruise ship or because they were on a flight have all been identified by the public health departments, by the public health authority, and they're being monitored across the country for development of signs and symptoms. And so it's unlikely that someone would just present to an urgent care or an emergency department or through a 911 call saying, I'm worried I have Andes hantavirus. All those individuals are being monitored by the health department, and if they were to develop signs and symptoms, we have confidence that the public health authority would direct them in a controlled manner for further assessment as was needed. So I think that should give us in the EMS community and frontline healthcare community some reassurance or confidence that the likelihood of identifying someone with Andes hantavirus in the community is exceptionally low. Now, we know that in North America, we're going to be hosting the 2026 World Cup. And so there is a possibility of having someone come in the community who's visiting from an area, select areas within Argentina or Chile, whom may have some increased risk of having had exposure to Andes hantavirus there. And this is where on the identify piece, it's really valuable to have an ability to call a friend. For us, that's often our state public health department through a toll-free number to get some assistance when needed, to examine what the signs and symptoms that the person's having, and then actually get maybe a more detailed history about where they've traveled in Argentina or Chile, and what parts of those countries, where they visited, that would maybe put them at greater risk to inform some further measures to implement the right infection prevention measures and direct that person for further evaluation. As it relates to infection prevention measures, what my friend Jill described in terms of standard and transmission-based precautions is what we would recommend for the EMS community as well. Standard precautions, of course, for all patients, then implementation of contact precautions, airborne precautions by way of an N95 respirator, NIOSH approved, fit tested, or higher, and eye protection. This is an adequate PPE ensemble for encountering somebody that may have this Andes hantavirus that be transmitted from person to person. So it's just important to remember that PPE ensemble, which most all EMS personnel would be able to implement if they had any concern. Hierarchy of controls for EMS personnel. Very briefly, we try to limit the number of individuals making contact with somebody that we think would be at greater risk for having a high consequence infectious disease. We try to keep the driver compartment separated from the patient compartment. We try to have the exhaust fan on high in the back of ambulances. If there was ever a need for ventilation of a patient, assisted ventilations with a back valve mask or with a ventilator, we would recommend using a HEPA filter on the exhaust ports. And there's a more robust guidance on implementing a hierarchy of controls for patients suspected of having a high consequence infectious disease. Actually, if you follow that QR code on the slide, which will bring you to some resources that NETEC has curated, either developed and or curated for the EMS community, which include the EMS infectious disease playbook, some model procedural guidelines for donning and doffing of PPE, the modification of an ambulance if that's what was needed, the cleaning of biohazard spills. NETEC also offers biosafety transport operator and technician level courses, which are offered through the regional special pathogens treatment centers and a core EMS work group. There's online education on this website. We maintain current blogs on specific HCIDs. So actually the Ebola outbreak currently ongoing in the DRC, we have a blog that would be appropriate for the EMS community to review, which would give some guidance on identify, isolate, and inform infection prevention, implementation of a hierarchy of controls for a viral hemorrhagic fever, and there'll be one there shortly for Andes hantavirus as well. And there's also opportunities for self-assessment of readiness. So the SPORZA is the Special Pathogens Operational Readiness Self-Assessment that any EMS agency can actually participate in and provide answers to questions that they're prompted to answer. Those are reviewed then by NETEC EMS subject matter experts with resource documents and feedback provided. There are also technical support services available through NETEC for EMS agencies who have need for that. I think, Jill, there may be one more slide that I have beyond this one. You saw this map earlier in the presentation, but each of these regional special pathogens treatment centers that were previously described, and there's 13 of them across the United States, have EMS subject matter expertise associated with them. Each of them has an EMS agency that's directly supporting them for the transport and management of patients in the out-of-hospital setting that are suspected or confirmed to have a high consequence infectious disease. They are a primary resource for the EMS community to get more information. And any questions, the NETEC EMS work group works together with these regional special pathogens treatment centers to provide answers to questions about out-of-hospital management of patients suspected or confirmed to have a high consequence infectious disease. And with that, I'm going to pause and turn it back over to Jill Morgan.
Thank you so much, Alex. So as promised, we have links to the NETEC Hantavirus exhibit page, some information about personal protective equipment, the new PPE matrix for all sorts of high consequence infectious diseases, including Andes Hanta, the lab resources about Andes Hanta, plus several other resources that we think that you'll find helpful. We are going to now turn to the Q&A section. So we have a number of questions that were submitted ahead of time. I am going to take the privilege of being the moderator and actually answer a few PPE and infection prevention questions to kick us off, and then welcome any other questions to be submitted through the Q&A function on the bottom of your screen. So thank you guys for coming back on camera. I did want to address a couple things. So in hospital settings across the United States, we use the phrase EPA approved disinfectants. And that's a really great thing for people to keep in mind. And infection preventionists are very familiar with those lists. But when we have an emerging pathogen, it can be difficult to figure out what is the best EPA approved disinfectant, even when we don't have something that makes a specific claim. We do know that these pathogens are in certain types that have been put in tiers. And so the EPA has 3 tiers of pathogens. And so you want to look for something in the same tier as the virus, in this case, that you're concerned about. So Andes Hanta is considered a tier 1 virus. That's good news because it is the easiest to kill cootie that we have out there. And so if you look for other EPA-approved disinfectants for hospital use that are effective against tier 1, that is what you're aiming for this. And so that's not going to be different than most of the things you're already going to be using in a hospital setting. A couple other questions about personal protective equipment, specifically about, do you recommend a trained observer? So I'm a big fan of trained observers. I'm especially a big fan of trained observers, obviously, when we have very high level or very complex PPE ensembles. I think that for the Andes Hanta and for other things where we're using gowns and face shields and respirators, the most important thing is to think about how you're measuring that competency at your own facility. So I tell people I probably could have been the Typhoid Mary of MRSA in Atlanta because for an awful long time in nursing, nobody ever checked my technique for taking off a gown or taking things off in the right order. So I really welcome you to go back and say, look, do we need a trained observer or do we just need to make sure people are trained correctly on these basic pieces of PPE that we're using probably very often, and that maybe we're doing a great job with, and maybe we're not. So I would say that this is not such a complex ensemble that I feel like we have to have a trained observer. But if you have people who are new to PPE, or if you doubt their techniques, then I think putting a trained observer in place until you get that muscle memory and people are doing it correctly is completely reasonable. The other question is really about how to approach PPE when you're talking about first questions, those first points of contact in our emergency departments. If you're the person sitting in triage, you should have some PPE available to you. I also really believe that source control works. So the first thing I want you to do if somebody presents with any fever and kind of complaint is to ask them to wear a mask. And I know that not everybody feels comfortable wearing a mask, but a source control mask on the patient is still the first great step to protecting ourselves as healthcare workers. And then thinking about personal protective equipment for a staff member who might be getting the rest of the story. And as Alex said, we need to get more information. Everybody that's been on the continent of South America is not going to be a person under investigation or a suspect case for Andes Hanta. Everybody who's been on a cruise in the last 6 months is not going to be a suspect case. But as our emergency departments know, we will get a lot of worried well people who might have the sniffles and sat next to somebody who was on a cruise, and we're going to have to screen them out and figure out who is a real risk and who's not. And for that, I think some basic PPE in your triage is perfectly reasonable. So a mask or respirator for your staff member, a face shield, obviously universal standard precautions with gloves if you're touching things. Then getting that patient into isolation if they are in fact a suspect case or you think they may be, And that's appropriate to have an airborne isolation room if possible. And if not, then you want to have, if you have a portable HEPA filter available to you, or making sure that at least at a minimum you have a private room with a door that you can shut. All right. Now, I'm going to turn it over to some of our panelists. I said we have a lot of questions that were submitted ahead of time, so we absolutely can go through and look at some of the questions that we received before. I know that there were several questions posted about how we felt about the people that are returning, people that might be under observation within our states, and what we need to do if one of them presents for treatment. Vikram, how do we evaluate a patient that comes in who might have this? Can you talk a little bit more about like exactly what people should be thinking about when they're doing an evaluation?
Absolutely. Thanks, Jill, and thank you. That was a wonderful question. As we were mentioning earlier, from the cruise ship and from a couple of adjoining flights, there are around 40 or so individuals in the US who are being monitored, 18 of them, of these asymptomatic individuals. And I want to discern that these are not patients, they're not symptomatic, they're just exposures. There are 18 individuals from the cruise ship who are being monitored at the Nebraska quarantine unit, and the other 20 other individuals are spread across our 10 HHS regions in multiple states, and all of them are being monitored by their respective public health departments. Each of these public health departments have had contact with their neighboring respects, the regional emerging special pathogen treatment centers, so that if any of these passengers were to develop symptoms of, say, fever or cough, these would probably be most likely myalgias and some pulmonary symptoms to raise the concern. They would be transported to the closest level 1, level 2, or level 3 NSPS facility and get testing. Testing would look such as, it would be diagnostic serologies at the CDC with IgG and IgM, and the potential for doing a hantavirus PCR. The only place currently in the country that does that is for Andes virus is at the Nebraska PHL, though other labs are developing that capability as well. Of course, you would look for other more common things such as respiratory viruses, and if the patient's febrile and is having respiratory symptoms, maybe an X-ray, blood cultures, and so on. We don't want, standard of care to be disrupted because someone is flagging that this is Andes virus. And, of really good being optimistic here is that so far, I know it's early, but no one in the US, either from the cruise ship or from the adjoining flights, has been tested positive, though there have been some symptoms here and there. Everyone's been negative and are being closely monitored at home. So, just to make the point that the chance of someone walking into your emergency room is fairly unlikely, because anytime these individuals develop symptoms, they've been requested to call their public health departments so that the response can be fairly structured at a level 1, level 2, or level 3 capacity.
Thanks. I think that really coincides with, we heard from Gabi Frank, who's an internist at Johns Hopkins, who was referring to a study that was done in the Patagonia region, where, again, there have been many more Andes Hanta outbreaks. And when they looked, and this was a longitudinal study looking at people who had fairly high-risk exposures and who developed Andes Hanta after that, and really of hundreds and hundreds, I think, I don't want to misquote, but I think it was over 400 people that they followed that had exposures. There was a less than 3% conversion rate of people that developed any Andes Hanta after that sort of exposure. So we do think that this is not another COVID, and this is not another Ebola. It is something to be taken seriously. I think that's why we're all here today, right? Because we do take it seriously. But the risk of this is still, as Vikram said, relatively low. I'm going to go back to Vikram for a second, because one of the questions was about, we've heard about the Nebraska quarantine unit, which is, I think, news to some people who perhaps aren't aware that we've had a quarantine unit in the United States. But is it the only quarantine unit? How many beds do they have? Can you just explain for just a minute about the Nebraska quarantine unit, which I think is just being called the NQU, which is not exactly an easy acronym for me.
Well, we're lucky that we have it, and it is a federal asset, but Vicky lives there and works there, so if it's okay, Vicky, I'll ask you to comment on how amazing an asset it is.
Yeah, absolutely. It is a 20 room facility. So it's kind of divided up into two different sides. We have 20 different places for people to quarantine away from everybody else. We have lots of procedures and policies in place to help those folks, and we try to be as accommodating as we can to the folks that are visiting there. So it's a fantastic facility, and it is a great option that we have available.
And just to remind people, so we quarantine people who are not symptomatic, right? We are quarantining them in many ways where we are restricting their travel. We're restricting their ability to potentially infect others, but they are not yet sick, or they wouldn't just be in quarantine. We would then have them in some sort of isolation in a healthcare facility, or even in some other environment. That's the definitions of those terms within the United States, but I would caution you, if your news source is coming from somewhere else, many people use these terms and there's some looseness to them. So when we say quarantine, here in the United States, we're talking about people who are not currently ill, who are being monitored. And unfortunately, the monitoring period for this particular pathogen is quite long, 42 days, but typically we would see infections within that 2 to 3 week period of time. So 42 days, the further we get out, the less likely that would be to occur. There's one more thing I want to say about this, and that's in terms of infectivity. Some of you may have heard us at NETEC talk before about the importance of being super careful with things like Ebola, because as the patient's disease progresses, they get more and more, there's more and more infectious material in them. And in fact, in Ebola, it can extend even past when somebody dies, their body remains infectious. So, those body fluids remain infectious. That does not seem to be the case with Hanta. So we got some questions about what about decedent management? So if a person were to die of Hanta pulmonary syndrome or Hanta cardiopulmonary syndrome, certainly during those events when you're doing critical care interventions, we want you to exercise extreme caution. But it does appear, at least in the studies we have from South America, where this is more common, that as the disease progresses, these people do not get more what we call viremic, right? Their viral load in their blood does not just keep going up on that big steep incline. So while I would certainly recommend and assume that people who are handling the deceased are doing so carefully and using appropriate PPE, this is not a situation where we would, for instance, say that at this point with what's currently known, that, for instance, this has to be handled in any other special way. Again, we have very limited exposure to this in the United States, and so we're relying a lot on our partners in South America to help us with those sorts of guidance statements. Anything else you guys want to add to that? All right, Vicky, I am going to turn it over to you. Just if you'll review a little bit about Andy's specimens and just maybe general, not necessarily diagnosing for Andes, but if you have a clinical specimen of somebody who might have Andes, what precautions do you need to take for that?
Yeah, so there is a risk to laboratory staff if you have specimens that are infected with Andes virus. So we know in the laboratory that we do some special things that can cause aerosols or other risks, and there has been laboratory acquired infections in the past with different procedures. So the recommendation is to use BSL-3 precautions. Now that can look a little bit different in different laboratories based on what their setup is. If you have a biosafety cabinet, we do recommend that you utilize the biosafety cabinet whenever possible when you're handling the specimens. But things controls in other places, such as enhancing your PPE, maybe reducing the number of staff in the area, maybe you're adding some additional racks or something to, carry specimens, something to mitigate some of that risks, to help eliminate the possibility of spills, splashes. If you're utilizing something that may be generating aerosols, maybe looking at something that could do the same test, but maybe on a point of care version of it would be an option. So really just looking at all of those different pieces and then implementing mitigation risks to really help the personnel be safe. So again, there's lots of different ways that you can do that, and every laboratory is different. So it's really taking a comprehensive risk assessment and looking at all of the possibilities where you could have some of those issues. Again, I know that's sort of clear as mud for some people. There's a lot of variation that based on the laboratory configurations and how they work and what workflows look like from lab to lab. But if there are specific questions, again, you can reach out to netec.org, ask your laboratory questions, and they will go to one of our laboratory SMEs that we have or to me directly. And I'm happy to help walk through some of those specific questions that people might have.
Yeah, thanks. I do want to ask another question, Vicki, and I know you mentioned a little bit about IG and serology. What specimens are being collected? And then once you tell us what specimens are being collected for this, I'll talk about what PPE people should wear when they're collecting them.
So right now, if you're sending it out for diagnostic testing, it's either serology, so serum samples, which would require a centrifugation, right, to get your serum. So that's for your IgG and IgM. The PCR test or the molecular test right now is EDTA or the purple top whole blood. If you're doing just basic routine laboratories, it could be a variety of specimens based on whatever it is, the person needs to manage their case. And so you could be looking at different specimen sources, and all of those based on some literature out there, all of those specimens could potentially be of risk for carrying some virus and would be of risk for the laboratorian.
Yeah, so I think, obviously, whenever we're dealing with blood specimens or obtaining blood specimens, we want to use, our standard precautions and making sure that we're protecting ourselves. For these, I think we've talked about the PPE. We would like for you to have on eye protection, a respirator, gown, gloves. And when we say gown, we mean, a more protective gown than probably what I affectionately refer to as a cruddy yellow isolation gown, but something that offers a little bit more fluid protection. When you're drawing blood specimens, you are necessarily right up next to that patient. You might be leaning in towards their face, nose and mouth. And so really thinking about making sure that you have a good respirator on and that you're wearing eye protection. And then anytime somebody is obtaining a specimen, and for instance, depending on what symptoms brought this patient to your facility, if they have upper respiratory symptoms, getting a specimen, a nasal swab, a nasopharyngeal swab on somebody is quite the intimate project, right? I mean, you might be inducing a cough or a sneeze. You're going to be right up in their face. So really making sure that people are being cautious in those situations. You don't need to put on a spacesuit, but if you're somebody who can't wear an N95 or you haven't been fit tested in N95, do you have a PAPR or CAPR as an option for that? Really thinking about what your ventilation and airflow are, making sure that you're not standing in a place that's brushing or pulling the patient's emanations towards your face. So really trying to be cautious as you would think about the early days of COVID. And we don't think that this is being spread in that same method. And yet to get those kinds of specimens, you are very close, in very close contact.
And just one other note on that, Jill.
Go ahead.
I just want to add to that N95, just in case people aren't aware of that, which I think most are in this situation, that you do need to be fit tested for an N95. We want to make sure that that mask fits you appropriately and has a correct seal in order for you to get the most protection.
Yes, I think the phrase every time is a NIOSH approved, fit tested N95 respirator or higher level of respiratory protection. All right, so I know we're getting close to the end of our time. I would like to give our panelists any last nuggets that you think we should get out there that you may not have stated, or a last question that you want to answer. Alex, I'm going to start with you.
Well, thanks, Jill. Really pleased to join this panel and share some information around Andes hantavirus and how to protect ourselves from it. But I think, as every speaker has noted, the likelihood of encountering a person with Andes hantavirus through the course of daily operations in your emergency department, in your urgent care center, is exceptionally low. It's always good to be vigilant, implement the identify, isolate, and inform paradigm. But all these travelers who have had close contact are being monitored by the health departments, and so should they develop signs and symptoms, they're going to be directed where to go, and the people that are waiting for them know what precautions to take. I think for frontline healthcare personnel, as we're going to invite hundreds of thousands of visitors to the U.S. for FIFA World Cup, just be vigilant for any infectious diseases and communicable diseases that we may not more routinely see. And one way to do that is identify, isolate, and inform.
Thanks. Vikram?
Thanks, Jill. A quick couple of things. One is I want to thank Jill and the rest of the NETEC team here for bringing us panelists together and allowing us to share our experiences and our perspectives here. And the second thing, team, is, I recognize that there were close to 1,400, 1,500 people who took time out of their busy lives. And I think, just building this community, be it Andes virus, be it Ebola, be it what the World Cup brings us or some other threat, these town halls just allow us to build community so that if there is something that we can collaborate on together, if there's a resource that we can share, this is the group that we love to collaborate with further. As you know, on the NETEC website, lots of resources there. So just some of the questions that we couldn't get to today, we'd love to either answer or email or get across to the NETEC website. So please use this as a resource. And, looking forward to having many of you at our next town hall, which should be coming up pretty soon. Thank you.
All right. Thank you. Vicky, any last statement? I mean, you got the respirator piece in there, so I don't know what else you want to say, but feel free.
No, just happy to help if there's additional questions. I know there's still a lot of questions, and some of this is a little bit unclear at the moment with lack of designation from DOT, but happy to help walk through anything if anybody has additional questions. Thank you.
Yeah, thanks. All right, so I'm just going to wrap up a couple things here. Hantavirus, Andes hantavirus, is not currently a Category A pathogen in the infectious agent in the United States. Therefore, the letter of the law says you can package it as Category B waste, but we encourage you to use extreme caution when handling that waste in your facility, and have a conversation with your waste vendor, who deserve to be protected as well, that you might be dealing with an Andes hanta waste patient. Second, wear PPE, protect yourself, please. We need the healthcare workers we have across the country. I want to thank the panelists today, and please, if you have further questions, as Vicky and Vikram said, we'll try to get as many of these questions answered and put on the NETEC website, but we encourage you to actually, we have another webinar that's coming up about World Cup preparedness. We will have these slides and these resources available on the NETEC website just as quick as we can. We appreciate your patience with that as we try to get things initiated quickly. And if you have further questions, please don't hesitate to reach out to us at netec.org, and you can see all of the resources that are currently on a response page there at NETEC's homepage. So thank you very much for joining us today. Thank you for keeping each other safe. And we hope that we make it through both the Andes hanta outbreak and the Ebola outbreak with as few serious illnesses and deaths as humanly possible for everyone. So thank you very much for joining us. And we hope to see you again soon on a webinar, podcast, or on the NETEC website. Thank you.